welcome to another informative and educative edition of Good Way to Health, an hour-long program brought to you by the Ministry of Health, of course designed to educate, inform, and empower Liberians about health-related matters, giving you the tools to make informed decisions about your health. Today is Tuesday, September 23rd, 2025, and driving you through this edition of the program, Angelina and
Melvin Stewart.
we have Augustine Garma here, making sure that you get access to this program through the ministry's official Facebook page. However, where you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always a pleasure to be here with you. For those of you joining through the ministry's official Facebook page, we'd like to encourage you to like and share the live stream. And for our dedicated radio listeners, we'd like to say increase the volume of your radio, invite a friend or relative to listen along with you. We'd like to take a moment to send special greetings to the Minister of Health, Dr. Louis Porto, or able deputies, assistant ministers, and all of the staff at the Ministry of Health. I'd like to say thanks in a special way for your continual commitment to shaping the health agenda of our country. Well, this morning we have invited in studio two esteemed guests, Dr. Joel Tapekoli, Monserrado County Health Officer, and Mrs. James Etta G. Smith, the Director of Non-Communicable Diseases and Injuries Unit at the Ministry of Health. They are both here this morning to educate and create awareness on cervical cancer and that of the upcoming HPV vaccination campaign. We'll take a very short break to be right back with details. Welcome back and thanks for rejoining us. We're now joining our guests in studio. Beautiful Winnie, good morning. Let me begin with Mrs. Smith. Good morning. Welcome to the program.
Good morning, thank you.
Okay, welcome again to Good Way to Health. Dr. Colley, good morning, welcome.
Good morning, Angela. Good morning, everyone.
I like the smiles you people putting up this morning. So, how is the non-communicable diseases United Ministry of Health, Mrs. Smith? Well, you begin by talking a little about yourself, that will listen on who you are in the medical unit.
So good morning, everyone listening to us in Radio Land. So I'm James Ethel Clayton Smith. I'm a director for non-communicable disease at the Ministry of Health. The non-communicable disease unit is responsible to lead and design programs and intervention for the reduction of cancer in Liberia. And for this radio discussion, we are here focusing on cervical cancer. That is the responsibility of the unit, and we do not work alone. We work closely with all of the county health teams. That is why we are collaborating today with Monserrado County Health teams to create awareness about cervical cancer, so that the population can be aware and take the right action.
Okay.
Thank you, Angie.
Okay. Dr. Colley.
Yes, ma'am.
Good morning again.
Good morning.
Okay, who is Dr. Colley actually? We have new listeners. Just tell us a little.
Okay, good morning, Angie. Good morning, everyone. So my name is Dr. Joel Tapekoli. I'm the County Health Officer for Monserrado County. The County Health team, that's the implementation arm of the ministry at the county level. So Monserrado, you have Monserrado in all other counties. So at the county level, we implement all health activities by the Ministry of Health. We will also collaborate with other partners implementing health activities at the county level.
Okay, Melvin?
Yes.
Welcome our guests a little.
Let me welcome you people again. The last time we were here again together. And it's always good that you share some of the unfolding issues at the Ministry of Health, especially at the county level. Let me start the ball rolling with Mrs. Smith. Let's hear you on these non-communicable diseases. What are they, and how do you go about identifying those non-communicable diseases, and what are the fights? What are the effects and treatments toward them?
So when we talk about non-communicable disease, there are a lot of conditions that we categorize as non-communicable disease. But for today's discussion, we want to focus
On cervical cancer, I know, but I just wanted also
So I will just
maybe
throw
maybe
light
for
on
2
few
minutes.
of them.
Yeah, okay.
So non-communicable disease, cut across hypertension, which we refer to as high blood pressure, diabetes, the sugar sickness. It also considers the management of all forms of cancer, breast cancer, cervical cancer, and prostate cancer. I think over the last few weeks we were here talking about prostate cancer, so it's all part of the intervention for non-communicable disease. We are also responsible for the management of sickle cell disease in Liberia, as well as all other genetic conditions, people that are born with certain birth defects. Our responsibility also cut across management of disabilities, all forms of disabilities. Children that are born with clubfoot, children that are born with no big hairs, that we refer to as hydrocephaly for the medical term. We are also responsible to manage all of those conditions and be able to design programs and intervention for the prevention and control of those conditions, as these conditions are listed. So it's a very big unit, but in terms of programming, we have all of our strategy in place for all of these intervention or conditions that are listed. And as we said, for today, we want to narrow our focus on cervical cancer, so we can have a focused discussion.
All right. So let's hear from the county health officer of Montserrat. What is this cervical cancer?
Cervical cancer is referred to cancer of the cervix. So the cervix is the part of the uterus that we call womb in a layman term, and it comes about when you have, like all the cancers, when you have, abnormal growth of the cells in that particular area. And cervical cancer is one of the commonest female cancer in Liberia. It's one of the leading causes of cancer-related death in females in Liberia. Worldwide, it ranks 4th, but in Liberia, we looking at the patients we see in the hospital, most of our female patients that come down with cancer, out of 10, we find maybe 5 or 6 with cervical cancer. But as we go along the discussion, we'll talk about what are some of the causes, the leading factors, how we can prevent it, and screening will come in place. That's what we'll do.
So at Liberia level, Dr. Crowley, how common is the cervical cancer?
Like I said, cervical cancer is very common. So maybe the director would show like on the exact statistics, but it's very common looking at the clinics. Me being an OBGYN, some of the patients that we see in the hospital, most of our female patients that come down with cancer, like out of 10 patients, you find like 6 or 7 would have cervical cancer. Even though there are other forms of cancer, we have liver cancer, we have ovarian cancers, but when it comes to female cancer, cervical cancer rank #1 in Liberia.
Okay, that's it.
Yeah, so like the CEO mentioned, cervical cancer is the most common form of cancer in Liberia. And in terms of the statistic, in 2020, we're able to identify over 600 cases in Liberia. But I can say that data is old, we don't have a current figure. And based on all of the findings at the clinical setting, it shows that there is an increase and it is alarming. And as a program, we are making sure that we put in various intervention, especially in terms of encouraging clinicians to be able to record those data so that we can be able to analyze it and make informed program decision. So currently, we are working with GFK. We have the cancer registry. So the cancer registry collects all of the cancer data. So once we have all of our data in place over time, we'll be able to give a full statistic on the various variety of cancer in Liberia, especially cervical cancer in Liberia.
So how does one come down with cervical cancer?
So cervical cancer is caused by a virus. We call it the human papillomavirus, but people call it is HPV for short.
HPV.
Yes, but it's the human papillomavirus. The human papillomavirus is the one that is responsible for cervical cancer. But human papillomavirus, there are different strains of human papillomavirus. I mean, over 200 strains of human papillomavirus. But the high risk human papillomavirus, those ones that cause cancer, we're looking at 16, HPV 16, HPV 18, we have 33, 31, 45, those are all high risk cancer. But the most common ones, they are HPV 16 and 18. There are also low risk HPV strains, which is the 6 and 11. You find out that people with genital warts, those abnormal growth around the private area, is caused by also the HPV virus, but those are non-cancerous. Or the cancer strains are 16, 18, 33, 31, 45. But there are various strains of HPV virus. And how do we get this HPV virus? It's getting through contact. In contact, sexual intercourse, skin to skin contact with someone who has the virus. And the virus doesn't have to show maybe physical symptoms before somebody can get it. So skin to skin contact, an infected person, so having unprotected sex, those are all ways people get the virus. People who are engaged in risky behaviors, multiple sexual partners, those are all ways people get the HPV virus.
Which ones are the most prevalent ones here in Liberia?
So the 16, the 18, the 6 and the 11, those are the common ones in our sector.
What ages do we find cervical cancer?
So the thing is, you once you contact the HPV virus, the body has its own way of reacting. So people with good immunity, the body will clear it out over time. But there are some people who will progress into full-blown cancer. So not everyone that contacted HPV virus progress into cancer. Not every female, since we're talking about cervical cancer. So once you contact the virus, and the virus takes sometimes 8 to 10 years before it replicates into a full-blown cancer. So a 45 or 50-year-old woman that comes down with cervical cancer must have contacted the HPV virus much earlier in her lifetime compared to now. So we're looking at all ages, so you can contact the HPV virus at any age. But when it comes to cancer, because it has a long time to progress, you see older women mostly coming down with cervical cancer.
Okay. So, but according, how can one prevent this condition?
So there are different ways. Maybe I thought my boss layer will show some light. So there are different ways to prevent cervical cancer. That's why we're here on the air creating awareness, so our people can, take heed and, to act in time. Because, when it comes to cancer, once you hear cancer, people panic a whole lot. And our setting we're still, trying, the ministry is trying, for services, advanced cancer treatment is very limited in Nigeria. We only have, medical treatment, but when it comes to cancer treatment, there are different forms of cancer treatment. So detecting it early, treating it early is very important, because again, it's one of the most preventable cancer. It's easily treated once it's detected early. So to prevent cancer, one of the commonest way we can prevent cervical cancer is by the thing that causes the cancer, the HPV. So we do vaccination. So currently the ministry has we have incorporated HPV vaccine in our routine immunization services, where we vaccinate 9 to 14 years old girls. But again, we used to give 2 doses, but the ministry has re-strategized, in which maybe the program director can talk about that later on, into a single dose. So vaccination is one of the key preventive measures. And as we said, people that engage in multiple sexual partners, reduce it, having safe sex, and also regular screening. Because if you screen, or if you get tested and you're negative, those are all ways that we can prevent cervical cancer. So vaccination, screening, reducing risky behaviors, and reducing our sexual partners. And also smoking. Smoking is one of the key things that reduces our immunity, and because smoking will not give you physical cancer, but it reduces your immunity. It makes you more susceptible to any form of cancer.
When do we expect this screening to begin, and how long will that go for?
So I'll speak for Montserrat. The program
From-
manager can speak for other counties for the
Okay.
entire country. So since I'm limited to Montserrat, I'll soon speak for Montserrat. So for Montserrat, we're starting our screening very soon across the county, and we're targeting 4 hospitals right now, and 3 hospitals, I'm sorry, JFK, Redemption, and JDG. So the screening will, anybody can come for screening. It's free of charge. So, but there are screening days because we don't want to interrupt the normal services of the hospitals. So for JFK, for the screening days are Wednesdays and Fridays. For JDJ, they are also Wednesday and Friday. For Redemption, we have the screening days are Tuesdays and Fridays. So those are the screening days at the 3 hospitals. We're encouraging everyone to come, get tested, get screened, and then we have what we call, what this kind of screening we're doing is called the VIA, what we call visual inspection with acetic acid, and then those that will test positive will also have other interventions that we will carry out.
Madam Director, you want to speak to that issue generally, because you head that area.
Okay, so just to add to what Dr. Colleagues mentioned, we've been collaborating with Montserrat County Health Team. So our unit was part of the training for those facilities. We are also supporting and ensure that these services are rendered in those 3 facilities she mentioned. So for other counties, we have pocket of intervention, even though we say we want to increase services, but we know that it's not sufficient. So just to EMR, in Meridian County, we have a partner in health. They have providing services as it relates to screening for all forms of cancer, including cervical cancer. So we can have services across all of the facilities in Meridian County. We also have screening taking place during outreach. We have a local NGO partner, Phil, that doing outreach in Montserrat and Margibi. So they also go in the community to do screening, where they are identifying cases and also referring them to GFK because it's there that they are able to confirm these cases. For other counties, the screening are mostly done at the health facilities. So we are still working on expanding services like providing a training to health workers so that they can be able to diagnose these cases early and refer to where they can have services being rendered. Because we don't have the services across all of the counties. So in CB Doma, we also have services being rendered
In Banga.
in Bangabon County. So we are still working as a program to learn lessons from what will be happening in Montserrat County. So we consider that as a pilot because we want the county health team to be able to lead. So whatever is being done in Montserrat, we're going to learn lessons from that and replicate it across the other 15 counties so that we can have consistency in the way we screen, manage, and refer for the management of cervical cancer.
Yeah, so it's a case study here in Montserrat.
So we started with Montserrat,
Yeah.
learn lesson and then
And expand.
to
But
other
I'm curious to know. I know this is a concern to most of the listeners, especially those areas that are hard to reach, where you don't have vehicles reaching so easily to meet to screen and all of that, and people don't even have the financial willpower to come to Monrovia or to come to the urban area for all their tests. What will you be doing from the end of the Ministry of Health?
So you know the health system, we have a structure. So we have the national level, we have the county level, we have the district and the community level. So we also have community health workers that create awareness about these conditions, but they are not responsible to manage. So they encourage community members to go to the health facility and be able to screen for this condition. So we continue to work with the community health structure to educate communities about the importance of going to the health facilities for early screening in detection of this condition. So for now, that is our approach at the community level. But like I said, there's another NGO that doing mobile outreach. At the end of that outreach, we will all be able to listen to what best practices that we are able to adapt as a program and as a country to see how we can be able to tailor it across other counties where possible.
Incha, you want to comment? So let's hear you, both of you. Are there costs attached to the screening, and if so, how much? And after which they've been screened and notified of developing cervical cancer, how will they be placed on the treatment?
Okay, let me go first. So the screening is free, and I've already mentioned the days. We've started already. So tomorrow is Wednesday. I was just viewing a patient. I saw someone asking. So the screening has started. So for GFK, I will say again, Wednesday, tomorrow, moving forward, Wednesday and Friday. JDG Wednesday and Friday, redemption Tuesday and Friday. So if you missed yesterday, you can go Friday, and then we have our contact doctors at the hospital. So for GFK, we know GFK is big, so you're not going to go any part of GFK. Please go to the maternity hospital, the Labrador Friendship Japanese Maternity Hospital. GFK, we have our contact doctors there, Dr. C1, Dr. Lee, for JDJ, Dr. Ozi, for redemption, Dr. Kotima. So they are the ones that we're working with for the screening. And I didn't get the next.
So after
okay,
screening.
So we are doing something called the screening. There are different modes of screening for cervical cancer, but we are doing the visual inspection with acid, and then we are screening for pre-cancerous lesions. So before cancer, let me say that.
Okay.
So for those who we would, maybe let me just describe how the screening will go about. So we have something called the household vinegar that we use around here. So this is acidic. So it's placed on the cervix or the womb, open up. Same in regular, we have our mother's listing. So it's placed there, and then we wait for about a minute or two. What happens is that pre-cancer cells or cancer cells produce something called, they have a lot of proteins, and they react to this acid, producing something called very white lesions. So if we see patients with such lesions, we treat right away. So it's a see and treat approach. So for those with smaller lesions, we'll be treated at those hospitals that I mentioned. For those with larger lesions, we will do further testing where we do a pap smear and also do biopsy of that lesion to see whether it's a full-blown cancer and at what stage the patient is.
All right.
So we're not going to screen and just let you go.
So no money business.
No cost attached for now.
For now, yes. But in the nearby future,
I can
there will be.
To that. For now, there's no cost attached. It's free.
Okay, that's good.
Yes. So, Dr. Colley, the screening is very important because that way, we will know the next step to take. Well, something should push a person to go do the screening. One way or the other, I'm thinking that if you send something and you say, okay, I'm not satisfied with this thing, let me go and do my screening. So let's just give a little idea of, the symptoms, some of the things that the people should look out for to be pushed. I know that the screening should be something that every woman should do at least, but something that people should look out for in terms of symptoms.
I would say don't look out for anything. For when it comes to screening, once you start in cervical cancer, once you start to see symptoms, most likely you are more than stage 1 cancer, and you are full-blown cancer. And then you don't fit in this program, then you go straight to treatment. But the screening that we are doing to detect people that have pre-cancerous lesions to be treated before it gets to full-blown cancer. So you don't have to wait for any symptom. We are screening everyone, most especially ages 25 to 60 years, because like I said, once you contact the HPV virus, it takes some time to manifest into pre-cancerous lesions. If those lesions are not treated, you will progress into a full-blown cancer. So the signs and symptoms of cervical cancer, we can discuss that. But when it comes to screening, the screening is open for everybody. Don't wait to have symptoms. So signs and symptoms of cervical cancer include, for example, some of our mothers that have passed their regular period time, so their monthly menses. So once you reach your menopause and you see yourself start to bleed, that's sign of cancer. People, having bleeding after sexual intercourse. Elderly women over 40, and you're not receiving, you're not seeing your menses, but you're bleeding after. So there's also something called this increase of foul smelling discharges or fluid coming from the private part that doesn't smell very well, peeing under the belly. And sometimes people lie down and feel something called what we call gnat, but in medical term we call it mass, mass. So those are all common symptoms, signs or symptoms of cervical cancer. But again, once you get to that stage, then you don't qualify for screening. You go straight for treatment. So those we are screening people that don't have cancer or we suspect that don't have cancer. So once you come to be screened, we detect maybe a very very large lesion, then we will progress straight for a biopsy. And then once we biopsize the lesion, and then if they tell you maybe a stage 1, stage 2, stage 3 cancer, then we put you in the treatment program, which there are different modes of treatment for cervical cancer. But we are screening precancerous, and we are screening ages 25 to 60, and we're screening anybody. So don't wait for symptoms before you.
Okay, let's just make you want to add to that.
Yeah, just to add to what our colleague mentioned. So in the early stage, there is no specific signs or symptoms. So we encourage people to present early for screening, especially if you are sexually active, you are at risk. And young people that engage in early sex, they are more at risk of cervical cancer. And as you earlier mentioned, people who smoke, because smoking reduces your body ability to fight any condition. And if you have identified the risks, we encourage you to come for screening. So don't wait for signs. Cervical cancer is preventable. It can be treated. That's why we are here educating the public to come early, especially females of reproductive age who are sexually active as well, to present early so that we can be able to screen you and come up with some management if we identify that you are at risk of cervical cancer.
So let me ask this question. This cervical cancer is is something very dangerous from what I'm reading through here, and it's always be most likely at the end of the uterus. So I'm curious to know as to whether when a female has this cancer, whether they have not been tested or screened. Do they? I mean, unknowingly, they just sit by themselves and blame all of what happening to them, like you named some of the symptoms, bleeding and all of that. And do they have a chance of bearing child?
Okay, it depends first and foremost on the stage of the cancer. I've seen a couple of patients with, we had a patient with full-blown cervical cancer in pregnancy. Unfortunately, she passed, but the baby survived. So we caught her when she was around 5 months. She came to the hospital bleeding, so we thought there was some other pregnancy-related bleeding. But when we checked her, she had full-blown stage 2 cervical cancer. So we're managing her until she delivered. But then sadly, she passed due to complications of her cancer. But again, the cervical cancer, or we call the cervix, is the opening of the womb. It's not the entire womb, it's the opening. So cancer at that stage, at that area, we all know how a woman gets pregnant. So from sexual intercourse, the sperm enters that portion of the womb called the cervix, the same way it enters. So sometimes the cancer occlude or cover that entire mouth. So even getting pregnant is also very, very slim. But it's not impossible.
Now, if a woman has this cancer, and like you said, you delivered one woman and she passed, did the child come negative? Is it possible for
Sexually active. I think I have
So cervical cancer cannot be.
It cannot be
treated.
okay.
So the virus, the HPV virus that colleague mentioned, is the considered agent. Is that virus that causes cervical cancer?
It's not transmitted by blood.
It's not transmitted by blood.
So,
Yeah, he's a male,
she
so
can
please
translate
forgive. But that colleague, how often should we go to get screened? And when a person is positive, what are the treatment options?
okay, so for screening, we said temperature recommended 30 to 60 minutes for screening, anywhere between the assuming probably you came in contact with the virus around 18, 20. So before you even start to manifest the cancer, you're around your, mid 30s. But for this screening for Liberia or this Monserrado, we're going much earlier than 30. So we're starting at age 25. So we say 25 to 60. So for the there are different modes of screening. We have the HPV DNA testing, which is worldwide recommended by WHO. But then on the flip side, it's very costly. It's not really, it's not, you know, very okay for low-income country like Liberia. So the next one we're doing is the VIA, which is it has good rate and also it's very affordable. And besides that, for the VIA, you don't need any specialized person to do VIA. So any trained health worker can do VIA. So recently, with the collaboration from the NCD unit, we were able to train 62 health workers across Monserrado. We train midwives to do VIA. So once we're done with this phase of the screening at the hospitals, our clinics will also be doing routine cervical cancer screening because our midwives were trained. And then once they see these lesions, they can be able to refer them to a bigger hospital. So if we see the lesion, again, we are looking for precancerous lesion. Once we see the lesion, we treat right away. So there are different treatment options. So we can do we do what we call, we burn the lesion with heat. So we call it thermal coagulation. We also remove it, like surgical removal, cutting. But then those are just precancer lesions. So if a cancer is detected, so if we see a big lesion that we know that it's
That
not
lesion is that area that has
yeah,
the
so
lesion.
lesion, I mean, sorry, so let me go little a bit. So we say lesion is like, how do I say it? Not so, or maybe mark or something, growth or tissue, yes. So once it's seen, if it's small, we can treat right on site. If it's bigger, they will refer. So the pathology lab at GFK, we send for biopsy, and then if it's confirmed, at GFK we have 3 gynecologists that we can refer those patients to, and then they can start their treatment. So as I said earlier, treatment range from surgery. So there are different forms of surgery. So surgery would mean removal of the womb. So we call that hysterectomy. So depending on the stage of the cancer, that's how the treatment will go. So there are other advanced treatment that we don't have in country. That's why we say come early. So when it's detected, we can be able, the one we can manage, we can manage. The one we can manage, we will refer to other countries like Accra and other places. But we don't want the looking at the economic status of most of our people, they can't afford. So people start to go for me. So before you even get the amount of money to travel abroad, it's almost very
late.
Do men have a role to play when it comes to breast prevention?
Of course. We say it's so yeah, okay, so men are also key players, even though they don't have the organ that but it's transmitted through sexual intercourse. It's transmitted by a virus. So you see men also have some men will have wax, genital wax is also, HPV virus related as well. So they have a role to play. So protected sex is also very key to prevent cervical cancer. So if they don't even have, for the men, they do get, if they don't have, so the HPV can also cause cancer of the genitals as well. Also anal rectal cancer can also be caused by HPV. So cancer of the anus or the opening of the pineapple.
Okay.
Let me say that. Yes. Yes, so it's also caused by HPV virus. So men can also get the virus, but it's just that they can't have cervical cancer because they don't have the cervix.
Okay. So Melvin?
So,
We can open the phone
of
lines
course.
after we talk about the HPV vaccination. Yeah, so if you just join us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. We have our health experts here, Dr. Colley and Mrs. Smith. We are here providing education on cervical cancer this morning. To be a part of this conversation, you can call us on 0775 677 0775 677 0880 0880 are the numbers to call. We have our first caller. Good morning. Your name and where do you join us from? Okay, go ahead, Emmanuel.
Thank you for your program guest. We appreciate that these things are very important for our people. My concern has to do with there are sicknesses the other education on. But what is the ministry doing? Like they talk about the HPV virus, right? Do we have the equipment to detect those sicknesses? And then, if yes, the treatment also available in the country? All of the information, but there are some sicknesses they talked about. They say you have to leave the country when it's serious. So what is the ministry doing to find a remedy to every time we've been going out of country for treatment, but instead we should stay here and be treated here too? Thank you.
Okay. Good morning. Your name and where do you join us from?
I'm John S. Kepler calling from Firestone Division Territory.
Go ahead, Mr. Kekuli.
Yes, one thing I want to know concerning this cancer. Is this condition very curable or it can just be managed by medical practitioners?
Okay, thank you. Okay, 088, do we have another call, Melvin? Okay, 08805140960775677376 are the numbers to call. Call us this morning and be a part of this conversation.
But we can hear from our professionals on the. Okay, let's take this person.
Okay. Good morning. Your name and where do you join us from?
My name is John Jala. I'm calling from Barnetsville.
Go ahead.
Yeah, I want to thank you this morning for this very, very interesting topic. My concern this morning, I want to appeal to all the young women, especially between the ages of 25 up to 60, that are hearing my voice this morning, to kindly go to JFK and meet with the health practitioner, and so that you can do your screening. Because I've worked in the hospital setting before, and I'm as a social worker, especially in the 80s and I know how doctors refer some of the incurable questions to us to talk to the family. So please, I'm talking to all the young women this morning, because they have the women to call. So please let the women call and be able to go to JFK and meet the doctors for the screening. Whether you're feeling pain, you're not feeling anything, but at least go and do the screening.
Okay.
Thank you.
Okay, thank you. Yeah, Dr. Colley, can you respond to the few concerns while we wait for?
Okay, so one of the caller asked whether it is curable. Blessing is cervical cancer is one of the cancers with very high cure rates once it is detected early. So the key word is early, because we have a tendency in our setting that we should fall down first before we go to the hospital. We don't go for testing, we don't go for screening. Some people will say, I won't know the thing that will kill me. But again, we just an appeal. it's sad to see a cancer that is highly treatable. The cure rate is very high. People dying from it in our setting. Other countries, cervical cancer death is like the bare minimum because number one, people who are working they mandate you to go for tests every year or every 2 years. But here we don't. So we're just appealing. We're not force you to come for testing. We're just appealing for your own health. It is treatable, yes, to the caller who asks, yes, but once it is detected early, that's the key message. Early detection.
So for the other caller, he mentioned that whether we have the capacity as a country to be able to manage. So it's still in line with the second caller question. So we said that the virus that causes cervical cancer is the HPV virus. And once you present for early screening, we are able to detect it and manage it at an early stage. So it will not advance to a stage that cannot be managed in country. So it's still an appeal to every sexually active woman out there, women of reproductive age, to present at the facility for screening. There is no specific sign to tell you that you have cervical cancer unless you come early and you are screened and be able to manage condition, especially when we detect there are lesions that we can manage at an early stage.
All right.
Prevent you from traveling abroad and economic burden on your family.
So pregnant women doing the screening too.
Yes.
Okay. All right. So we will read some of the comments on the social media platform of the Ministry of Health. We have several of our followers here online. Ben Cooper says he's watching. Ben Cooper Jr. St. James S. Ali Contet Jr. Is also following, and he's asking if the screening everything is free of charge for even non-Liberians. Yes, of course they answered that. They say it's free of charge until otherwise other. And Samida Enley Monger is saying there are preventable steps. Yes, they've labeled several of them, and she's also asking whether that's Kona Samson Kong is watching you people from this morning from Nimba Logwa to a border. Samilia also comes in with this second concern. My daughter took the HPV vaccine when she was 9 years old, and I was told that if she turned 12, she could go back. When she was 12 that year, we were told that it was not available, and since then she hasn't taken the HPV dose, that single dose. So you is a major concern in a way.
Yeah, we are about to.
Yeah. So so we can talk about the HPV small before if we still have time. We can take three persons, then we'll let it go.
So the vaccine we said earlier is the key preventable way we can prevent cervical cancer is the HPV vaccine. Other countries, because of the resources they have, the quantity of vaccine is given to all ages based on your testing. Because we don't have that capacity, we try to catch our girls before they become sexually active. That's why some will ask, why is it 9 to 14 years? We try to catch our girls, at that age. Someone might even say maybe a 14-year-old girl might be sexually active, yes. But a 14-year-old girl that's sexually active compared to a 40 or 30-year-old girl that's sexually active, the exposure rate is very, very low in that age group. So we tend to cover our girls ages 9 to 14. Previously, the ministry were using 2 doses. Maybe Mr. Smith can comment about we graduated to a single dose now. So it's single dose, and it covers 5 high-risk strains of the HPV virus. So currently, in Montserrado now, we started our vaccination campaign for Montserrado with support from UNICEF. We will be doing 1 month vaccination campaign across the county, vaccinating ages 9 to 14 years old. So the team will be visiting schools, the team will be visiting communities, the team will be visiting homes. So we encourage all parents to, the team will also be at the facility. So if you don't catch them, if they miss the school, please take them to the nearest health facility. So the vaccines are given to both public and private facilities. So for Monserrat, we have 175 health facilities that are giving the HPV vaccine. But as I said, we are on a current campaign that started yesterday, and we will run up to October 21st, October 22nd, sorry. But the ministry is also launching a nationwide campaign, which Mr. Smith will talk about, across the 15 counties. So no one should just, hear Monserrat. So Monserrat is not Liberia. So by November, the ministry will be launching a nationwide HPV vaccination campaign, and we've stepped up the age range. It's from 9 to 18, 9 to 18 or 10 to 18. 10 to 18 years, so we've stepped up to 18 years for the vaccine. So we're just encouraging citizens, everyone, you've heard us, please take your kids for the HPV vaccination.
Mr. Smith.
Yes, so at the Ministry of Health, we have a program that is responsible for vaccination, that is the EPI program. So our role as the NCD program is to collaborate with them in terms of providing the right information about cervical cancer. So as it relates to the vaccine, it is the EPI unique full responsibility. But in recent time, we were able to collaborate and we train national level trainers. We were part of that training that will go to all of the 15 counties, be able to work with the county health team to provide training on the administration of the new schedule for the HPV vaccine. So as Dr. Colley mentioned, that campaign is upcoming in the EPI program. I'm sure we'll come here to tell the public about more details about the vaccine. But prior to introducing vaccine, we are also working with the health promotion communication team, because we know that we want to increase the services, and then we have to create awareness so people can know that these services are available and what are the benefits if you turn off and get the HPV vaccine, which will prevent you from cervical cancer. So these are things that we are collaborating with the EPI program to ensure that we expand the services of vaccine beyond just Monserrat County.
All right, we take a few more calls on 0880-514-096, 0880-514-096, 0775-677376, 0775-677376. You can call and ask the question of your choice to our guest. Good morning. Good morning. We are okay. Please go ahead.
And my question is for you. The vaccine, when clinic doing the SRC vaccination.
You say what?
HPV, not
The clinic.
Where can people go to get the
All right.
vaccine?
All right. Thank you. Good morning. Morning. Good morning, madam. How you doing? Go.
The clinic talk about what is the meaning of JDJ? JDJ hospital?
Yes, Jane Dewe Hospital.
Yes. Thank you, madam. Just listen, yeah. They would speak to the. Thank you so much. You call the clinic name right? It's a JDJ.
Okay, so for the testing sites, the screening sites, JFK, John F. Kennedy Medical Center, the maternity hospital, the Redemption Hospital, and the Jane David, what we call JDJ for short, admin. And then someone asked about the vaccine. The vaccine is given to any health facility in Liberia offering vaccination services. So the ministry is not only restricted to the vaccination, not only restricted to public hospitals or clinics, because the ministry gave vaccine to also private facilities, because we want our children to be covered when it comes to vaccination. So any clinic or hospital that are offering vaccination services the HPV vaccine can be gotten there. But for Monserrate currently, aside from the hospitals or the clinics, we are also going to schools. We are also in the community for the next one month to ensure our girls are vaccinated.
All right. So I think we can take this last caller. This person has been on the line. Good morning. Morning. Please go ahead quickly.
Yeah, let's have a prostate cancer is an issue.
Our today's
But-
discussion
but-
is not on prostate cancer.
So we're talking about cervical cancer, yeah? Thank you. Let's take this last person. Morning. Morning, madam. What is your name and where are you calling from, please?
Okay, my name is Mafu, calling from Perth.
Okay, go ahead quickly.
I just came into the program late for part of it. I want to know if you are in your port, the pool in stop, just stop receiving probably like for 7 months. Now, I went to the hospital, told some people inside to receiving, but after 7 months, I just stopped it. So I want to know in that period, how can I get help?
Thank you. Yes, so yes.
Yes, so I want to encourage all women or the general population out there to always go for routine health checkup. When your body is not well, you'll receive signals. So like the last caller mentioned, those things that are happening to you, you need to go to the health facility, see or service provider that is trained to be able to identify what is causing that condition, and they will be able to manage you accordingly. So I want to encourage her to go to any of the nearby health facilities in Monserrate County where they will be able to screen her and identify what is it that is happening and be able to manage her accordingly. Do not go to the community doctor. Please go to the medical places or facilities that are recognized.
All right. So finally, from you, before we get a party comment of the CHO as well, Mr. Smith, finally, what can you see?
So for our call to action, we are encouraging women, we are encouraging mothers to encourage their children to take the HPV vaccine. We've already highlighted the importance to prevent cervical cancer. So the sooner, the earlier you detect, you are able to be managed for cervical cancer and being progressed to advanced stage of cancer. So it's the most preventable kind of cancer, and we don't want people to die from it. So let us go to the facility and get straight early.
All right, Madam CHO, quickly, just maybe 30 seconds. We are out of time.
Thank you so much for having us. This is our call to the public. Please don't come too late. Help is available. Once you come early, bring the children to get vaccinated and come for screening as soon as possible. About cancer, once signs and symptoms start to present, which means in a late stage of cancer, and then treatment becomes very, very hard. Some people cannot manage in Liberia. So we are appealing to everyone. Please, please, please. This is the platform the ministry has created, and it's for us to provide all relevant health information to the public. Thank you so much.
Thank you. Enjoy.
Well, so you just heard from our guests. Take the children for vaccination with ages between 10 to 18. Early detection is very important. They put you in the best position to be treated. Well, with that, this is how I would like to leave you on this edition of Roadway to Health. Many thanks to our guests for sharing such valuable insights. We have been your host this morning, Angelina Noah and
Melvin Stewart.
Augustine Gaima has been here. Until next Tuesday, have a good day.